What was it that caused you to dig a little bit deeper? So this is back in 2015 that you started on a
Right.
national level, and you said, "Hey, we're not addressing some of these major issues relative to infection." What were some of the things that you noticed at that time?
Yeah, well, when I learned the CDC research and statistics that there's 1 to 3 million infections, serious infections occurring in this healthcare setting every year that contribute to 380,000 deaths. So
Wow.
that's over 1,000 deaths every single day in this country from serious infections. And knowing that these harms were occurring, we're talking pneumonia, skin and soft tissue infections, multi-drug resistant organisms like MRSA and C. diff. I mean, none of us want, I mean, first of all, it's very difficult when we have a loved one in long-term care. I mean, that's kind of like our last place, we really try hard not to have to use that care.
Right.
But then, we don't want as professionals to be giving them or for, the transmission of an infection to be what ultimately causes so much harm and death. And I was just captivated by this. I was so passionate. And I was knocking at the CMS door. I was working with CMS. I was working with CDC. And I realized ultimately I didn't fit in a box. And so I had to break out and start my own company and really tackle this from a much bigger perspective and a bigger scale.
Well, I think you've done a great job of bringing this to light. That what you just talked about reminds me of a conversation I had with an internal medicine professional at one point, who her training, her background, growing up in Bombay, she said to me, "Steve, I dealt with infectious disease. I dealt with so many things there that we just don't see in America." Now, granted, she didn't live in this skilled nursing space. She didn't live in the post acute space and wasn't seeing that high infectious rate relative to the population that's in there. And so I think that was one of the things that really stood out to me as I read your book at the disproportionate amount of infections that we're seeing within that space. So you broke out, you created your own company called IPC Well. Tell our listeners a little bit about what your mission and what you focus on with your company.
Yeah, I mean, we're really focused on supporting long-term care. I mean, in the beginning, as I was, getting started, I was so eager to enroll all of these nursing homes and have them start reporting their infectious disease data into NHSN. And then I was told, like, nah, we're good. We don't need help. And I'd go into the facilities and start, seeing, what I didn't realize was I needed to start with step one in helping them with hand hygiene
Mm.
and environmental service and kind of the basics of infection control. You know, so we focus so much on-site support, and as you read in my book, there's so much punitive action towards our nursing homes.
Very much.
They're
Yeah.
constantly bombarded with just punishment after punishment. And I'm really trying to shift that narrative and say, let's, for God's sakes, help them and provide more on-site support and education. And we're really active and we're doing so much of that, hundreds and hundreds of nursing homes across the country. I'm just so excited about our work and the impact that it's having. It's so rewarding, and to see, especially the healthcare workers, they're so hungry for knowledge and help. So when you come in and offer that hand of help to them, it's really a breath of fresh air for them.